What is a Bartholin's cyst? In this video today, we are going to talk about the Bartholin's cyst. Hello my friend, I welcome you to our channel, Gerald Massa, the health educator. On this channel, we talk about the ovulation calendar, we do talk about the ovulation calculator, and we do answer all your questions in regards to women's health. Ask all your questions down below in the comments. I will answer all those questions personally. Remember to subscribe so that you watch new videos we release every day. I welcome you, my friend, for today's lesson. Welcome for today's lesson. Be attentive, watch the video up to the end, and you are going to benefit a lot. Would you like to get pregnant faster? Would you like to get pregnant naturally? Then this video is for you. By the end of this video, you are going to know what a Bartholin's cyst is and what is a Bartholin's cyst and how best it can be treated. So without further ado, we shall define a Bartholin's cyst, and we shall say that a Bartholin's cyst is called a duct cyst, and it is a fluid-filled sac just inside the opening of a woman's vagina. So what is happening is that when you are a woman and you have a small swelling which is filled with fluid just inside at the opening of your private parts, then this could be a Bartholin's cyst. So we are going to look at the symptoms of a Bartholin's cyst. You may feel a soft, painless lump. This does not usually cause any problems, but if the cyst grows very large, it can become noticeable and even uncomfortable. So you may also feel pain in the skin surrounding the vagina, that is the outer skin known as the vulva, when you walk, and then even when you sit down, and this pain increases when you have sex. So the first symptom is that you are going to feel a soft, painless lump which is just at the opening of your vagina. The cyst can sometimes affect the outer pair of lips surrounding the vagina known as the labia majora, and specifically one side may be very swollen. If the cyst becomes infected, it can cause a painful collection of pus known as abscess to develop in one of the Bartholin's glands. Signs of an abscess include the affected area becoming red, swollen, tender, and even hot. Remember to subscribe for new videos we release every day, and in this video today we are talking about the Bartholin's cyst. So if you are a woman and you have a high body temperature ranging from 37, 38, even going to 39, and you have a small swelling just at the opening of your private parts, then this could be a Bartholin's cyst. Remember, if the temperature is rising, it means that the infection, or it means that the swelling is becoming septic, or it is actually getting microorganisms multiplying and going into your bloodstream, and you should see your doctor immediately if you are a woman and you have a small swelling just at the opening of your private parts. So small Bartholin's cysts are sometimes found during a routine cervical screening test. This could be a test for cancer, but still your doctor or your midwife will see a small swelling just at the opening of your private parts. This examination may be carried out for another reason, but just as they are examining you for maybe cancer of the cervix, they may discover that you have what we call a Bartholin's cyst. Next is that you can also develop a lump in the area around your vagina, so the diagnosis has to be made by your doctor. In some cases, your doctor may recommend that you have a biopsy whereby a small piece of tissue is got from that swelling using a special needle known as a Finac needle or a fine needle aspirator. It is very important for this to be taken, because sometimes you may think that it is a normal thing, but you may actually think that it's not really harmful, but it can easily develop into something as serious as vulval cancer, also known as Bartholin's gland cancer. What are the causes of Bartholin's cyst? What are the causes of Bartholin's cysts? The Bartholin's glands are a pair of pea-sized glands found just behind either side of the lips of your vagina. So these are a pair of pea-sized glands, meaning that they are just around the size of pea, that is PEA. So they are just the size of that pea, and when I talk about pea, I'm meaning these peas which are actually cowpeas, these peas which are eatable. So Bartholin's glands are around that size, that is PEA. So what is happening is that the glands are not usually noticeable because they rarely become larger than 1 centimeter across. The Bartholin's gland secrete fluid that acts as a lubricant during sex. So the main function of the Bartholin's glands is that they secrete fluid that acts as a lubricant during sex. The fluid travels down tiny tubes called ducts into the vagina. If the ducts become blocked, they can fill with fluid and expand to form what we call a fluid-filled cyst, also known as the Bartholin's cysts. It is often not known why the ducts become blocked, but some cases are linked to STIs or sexually transmitted infections, for example, chlamydia, gonorrhea, and even other infections brought about by E. coli or Escherichia coli. How are Bartholin's cysts treated? If you do not have noticeable symptoms, it's unlikely that you will need treatment. So in this video we are talking about Bartholin's cysts. We have talked about how they present. We've said that they are normally, they begin from the Bartholin's glands, and the Bartholin's glands are around the size of pea, that is PEA, cowpeas, and then normally when they get blocked, then when they do get blocked, then it means they are going to be filled up with fluid, and this is what we call the Bartholin's cysts. If the cyst is painful, your doctor may recommend some simple self-care measures, such as soaking the cyst in warm water several times a day for 3 to 4 days, and taking painkillers you can buy from your pharmacy or a nearby hospital. If these painkillers do not help relieve, if you apply the warm compresses and then you do even take the painkillers like acetaminophen and they do not help, then several treatments are available to treat the Bartholin's cysts. So it is very, very important that when you have a Bartholin's cyst, you should be able to get treatment, and the best way of preventing Bartholin's cysts is that you should practice safe sex. That is, you should use a condom whenever you have sex, and also you should be having sex with only one person who is trusted. Thank you once again, my friend, for watching our video. Gerald Massa, the health educator, is the name of the channel, and in this video today we have talked about the Bartholin's cysts, and we have said that these are swellings which become of the Bartholin's glands, and normally they happen due to blockage. I welcome you, my friend. Thank you for watching today's video. Remember to subscribe if you are new here. Remember to check our videos. Tomorrow we shall be releasing more videos at exactly 17 hours. Thank you for today's lesson, and have yourself a fantastic and healthy day. Bye-bye. Thank you, my friend, for attending today's lesson. I hope you have learned something, and please, if you have any questions in regards to what we've just discussed, leave your questions in the comments. Ask me your questions. I will answer all your questions. On this channel, Gerald Massa, the health educator, I talk about women's health. Have yourself a fantastic and healthy day, and may God bless us all. Bye-bye.